Hey guys, welcome back on how to suture like a PA on MedScratch. Today we're going to be focusing on horizontal mattress sutures. This technique is mainly utilized to put wound edges back together that are really far apart and to bring back the gaping wound under less tension. This spreads tension more evenly across the wound instead of just in one suture location. This can be utilized in patients who are on chronic steroid use or people with really frail skin or just really large gaping wounds. So instead of closing that type of wound with trying to do a simple interrupted where you're causing a lot of tension to the wound where it might tear, this is a good technique to bypass that. And you can also use a combination of the two. You can start with horizontal mattress and then switch to simple interrupted as soon as you get those wound edges better approximated. And this is another technique you can use to put in your bag of tricks for a complicated wound. The downside of this type of suture is it can cause some wound necrosis. It can also use a lot more suture and it's harder to tie down. So I hope you guys enjoy this episode and let's get to it.
Okay, so we're going to make our first bite further back than a normal suture. And because we're doing that, we need to come out of the middle of the laceration. We're not going to be able to make it in one pass. And we're going to try to come back out the same distance on the other side. And then we're just going to pull that through. And now we're going to make a backhand suture. We're going to pick a distance between on this side, and we're going to start heading back in the other direction. And this is going to help spread the tension more across the wound than in just one spot like a simple interrupted suture would. So now we're just coming back on the other side, trying to make our bites consistent at each. Notice how far back our bites are compared to simple interrupted, where our bites would be much more close to the wound. And we're just finishing off this one with another backhand stitch, trying to come out at the same distance as our first stitch. And now that we're coming through on this side, you can see the distribution of the suture. And we're just going to tie this off with a simple surgeon's knot at the end. And for these, you may have to pull harder than normal to get the skin edges to approximate. Then we're going to tug to approximate the wound edges here. And now they're well approximated, so we're going to finish with a surgeon's knot. And we're just going to do a couple ties here until we finish our surgeon's knot. So there you have it. There is a horizontal mattress suture. Notice that on the surface, the suture line runs parallel to the wound. Horizontal mattress gets confusing if you're approaching a wound that's vertical, because then your sutures are then vertical appearing, but just remember that it runs parallel to the wound. And if this wound was bigger, we would do more horizontal sutures down the wound, but this wound is small enough where the one will be enough. The next technique we're going to do is we're going to do the combination. With this particular wound, we can go back and do simple interrupted sutures now that the wound edge is better approximated. So we're just going to evenly place some simple interrupted sutures utilizing our horizontal mattress now that the wound edge is close enough to close with simple interrupted. And we're just going to do a few there and close it. And when you're done with this, a lot of times you can just go ahead and remove your horizontal mattress sutures when you're done. And we're just going to speed through the simple interrupted sutures. You can watch my first video for that particular technique. And we're just going to cut this final suture here, and there you have it. You have a horizontal mattress suture to start to close the wound back together, and then we utilize simple interrupted to approximate those skin edges. And now we can just remove the horizontal mattress at this point if we feel the tension is going to be strong enough to keep the wound together. We just cut near the knot and apply the same concepts as the other suture removal techniques of just not dragging the exposed suture into the skin. And then you just pull out the suture across the wound, and that's how you remove a horizontal mattress suture.
Thank you guys for watching. Stay tuned for more videos.